that session.
We are live.
Oh, I see. Yeah.
Good morning. Let's call the Legislative Committee on Administrative Rules to order. We're meeting in person in the Pavilion Office Building, and welcome to those who are looking in. First item of business is to convene and review and approve the minutes of May 5th. Do we have a quorum? Do we have a motion? Okay. Representative Squirrel moves to approve the minutes of May 5th. Is there any discussion? If not, all those in favor say aye.
Aye.
And all those opposed say nay, and the minutes have been approved. And at this time, would ask that the committee introduce itself.
I'm State Senator Joe Benton from Caledonia County District.
Representative Seth Baumgartz from Bennington 4.
State Senator Chris Bray from Addison District.
Representative Trevor Squirrel representing Underhill and Jericho.
I'm Mark McDonald representing Orange County.
And Anthea Dexter Cooper from the Office of Legislative Counsel. And you have Senator Lyons.
And Senator Ginny Lyons is on Zoom from her home. And Charlene Dindo is our drum keeper and keeps us marching in the right direction. Senator Bray.
So just for the minutes approval, I was not here at that meeting, so I did not vote. And I don't know if that causes a hiccup because.
Because you have a quorum.
Okay, thank you.
Okay. First item on the agenda, 22P04, Department of Vermont Health Access Immigrant Health Insurance Plan. The witnesses are Ashley Berliner and Danielle Foucault, policy analyst from the Agency of Human Services. Who will be our first speaker? I can't read the name from this far away.
No sound for whatever reason.
There's no
There's
sound.
no sound. That's Danny.
Who is it?
It's Danny. I don't think Ashley is on.
Okay.
Danielle.
Danielle, you are muted, or we are failing to pick up what you have to say.
Maybe we could have Ginny speak so we know if it's everybody.
Oh, yeah.
Good morning, Senator Ginny Lyons, Chittenden County.
Let's not.
Thank you.
Okay.
We're having technical difficulties. And you have,
Probably on her
I
end.
think it's ours because Jenny, because
and because Senator Lyons has spoken, we think the technical difficulties might be on the other end.
Unplug.
So that's
It's
Danielle.
Danielle. She goes by Danny. That's why it says
Oh, okay.
Danielle. And I agree with you. I can't read that.
Danielle, we cannot hear you. Are you?
And down, try again.
Mr. Chair,
Yes.
is it better if I keep my video on or off? Which is preferable to you?
I guess it's your choice, unless you've got a dogfight going on in the backyard.
Only have the Capitol building behind me.
So we're hoping that our witness
And she's back.
still no audio. We can see that you are speaking, but we hear not.
Hi, is the committee able to hear me
there you
now?
go.
Yes.
Yep, there we go.
Yes.
Okay, thank you. I'm so sorry about that.
Thank you. Thank you.
Thought I had tested my speaker in advance. But
Yeah, a little bit. Yeah.
Turn it up a little.
Try again.
Let me know when you're ready for me to present.
We're turning up the volume. Go ahead.
Thank you. How about now?
I'm fine.
Sounds good.
Okay. Sorry about that. So my name is Danny Fiacco. I'm a policy analyst with the agency or Department of Vermont Health Access. I'm here to present the Immigrant Health Insurance Plan rule today, 22P004. Ashley Berliner sends her apologies. She is unable to join us today. We did not anticipate the time switch from 8 to 10. So she's great, sends her apologies to the committee. This is a new rule that establishes eligibility and enrollment requirements, rights and responsibilities, covered services and appeals for a new program called the Immigrant Health Insurance Plan, which aligns the program closely with the Medicaid or Dr. Dinosaur program. The Immigrant Health Insurance Plan, or IHIP, as we have been calling it, is for children under age 19 and pregnant people who have an immigration status for which Medicaid coverage is not available, except for emergency Medicaid. And this program was created from Act 48 of 2021. So this is a state-only program. I'd like to just give you an overview of the new program as outlined by the rule. Some things are the same as Dr. Dinosaur or Medicaid. It has the same income standard for children and pregnant women as Dr. Dinosaur. It uses the same modified, adjusted, gross income-based income methodologies, and it follows household composition rules for non-filers that currently exist. There's 3 months of retroactive eligibility available in this program, just as there is with Medicaid. There is a 45-day timeliness standard to process applications. The appeals rights for enrollees and applicants to this program are nearly the same as Dr. Dinosaur, with 2 exceptions. One is there's no right to an expedited eligibility appeal. And the second is that there is no requirement that they exhaust internal appeals for covered services. And these exceptions stem from the statute itself on appeals because they are specific to Medicaid. Enrollees will use the existing Medicaid provider network, and there will be no co-payments, just as there are no co-payments for enrollees in Dr. Dinosaur. Some things with the program are going to be unique to IHIP, or the Immigrant Health Insurance Plan. There is an additional level of confidentiality from the United States government, which stems from the statute. There is a requirement that enrollees be otherwise uninsured, and Medicaid does not have that requirement. There will be no premiums for children enrolled in the Immigrant Health Insurance Plan. And the application process is a little different because of the confidentiality from the federal government. Verifications for things like identity, age, and income will have to be done manually. We won't be able to use our federal database to verify these things. And then there are some covered service exclusions under IHIP. They're different from Medicaid. Particularly, there won't be coverage of long-term services and supports, or what's also known as home and community-based services. And then we did extensive public engagement with the rule, in addition to stakeholders that DVA usually reaches out to with rulemaking, such as the Medicaid Exchange Advisory Committee, Vermont Legal Aid, the Association of Hospitals and Health Systems, the Medical Society, Bi-State Primary Care Association, Vermont Care Partners, the Visiting Nurses Association of Vermont. We reached out to additional organizations that specifically work with this population and who also had some interest in the legislation. such as Migrant Justice, the Open Door Clinic of Middlebury, Vermont Immigration Assistance Project at the South Royalton Legal Clinic, Bridges to Health, the Association of Africans Living in Vermont. There is an anticipated economic impact for this rule. Covering this population will have a cost to the state, and there is no federal match available. The estimated cost is about 1.4 million annually, and this cost is based on estimated enrollment and utilization of services for approximately 22 pregnant people and 100 children each year. Again, this is a very much an approximation, and we will be closely monitoring the enrollment and utilization of this program. There are benefits to the rule as well, of course, with children and pregnant people who live in Vermont and their healthcare providers. They need this care. It's not otherwise available to them. And without this program, they could avoid healthcare, which could lead to more serious and costly adverse health outcomes over time, including to the state if it involves a newborn. A baby born in the state would likely be eligible for Medicaid. I very much appreciate your time today with this rule. If it is approved, we intend to file the adopted rulemaking by June 15th, and the anticipated effective date of the rule is July 1st, which is also the effective date of this new program. So thank you.
Okay. Before we ask questions, Representative Odie has joined us. We're now 6, and you slipped in unnoticed right after introductions. So
thank you.
We now open up to questions for the witness. Senator Lyons, you sent us forms suggesting that this was in conformance with statute, and would you like to comment on that?
Yes, it is in conformance with statute, and I think based on the number of organizations and individuals who have weighed in on this, this is a rule ready to go. So thank you. We did work on this. I can't remember when. It seems like a long time ago, but we did work on this in committee, and we're thankful for having the rule come to us from DEVA.
Secondly, thank you, Senator Lyons. This is a new rule, which the committee's been working with updates of emergency rules, and it has a unusually large number of technical corrections, thanks to Dexter Cooper and Jen Carby, who have gone through it with more than a fine-tooth comb, and have worked with the administration to make technical changes, not changes in policy, but having them dovetail neatly with statute. So any questions from the witness before we hear from our counsel on the technical changes?
Oh, I wasn't, do you want me to?
I know.
So
Cynthia Dexter Cooper will, without going into the technical details, will tell us what
certainly
what is before us.
So as part of the Office of Legislative Counsel reviewing this rule, Jen Carby went through it. She provided comments to Danny and Ashley, and they have incorporated that. And I believe the full result of that is the May 16th memorandum that you have. It, and I'm sure Danny can speak to this as well. It outlines the changes they made and provides some responses to questions that Jen had included. There also were updates to some of the forms that are filed. The one that I was the most concerned with was the one specifying that there is a records exemption in the rule, since statute says that the records exemption might not apply if it's not disclosed in the rulemaking process. So my recommendation to you from a process perspective is, if you are going to approve the rule, that you approve the rule with the modifications proposed in that May 16th correspondence, and substantive questions on any of the changes or the rule itself should certainly be directed to your witness, and Jen Carby's available. I can summon her with a text message if the committee wants to hear from her.
So for those listening in, the technical changes have to do with definitions and commas and abbreviations, and are not substantive, but important when you're administering, that the language is correct. So I believe the committee will find them purely technical, but for those listening, that's part of this discussion. Are there any questions for the witness? Senator Bray.
Hearing no questions, I would move approval of Rule 2204 as amended by the May 16th, 2022 memo.
Okay, Senator Bray has moved that the rule be amended with the technical corrections and then approved by LCAR. Is there any further discussion or any further questions for our witnesses? If not, all those in favor say aye.
Aye.
Hi.
All those opposed say nay. And the rule has been approved. Thank you.
Thank you very much.
Which brings us to 22E10, Department of Vermont Health Access Nursing Home Rate Setting Staffing Adjustment. Nursing home rate setting staffing adjustment. Very okay. For our witnesses, we have James LaRock for the Department of Vermont Health Access and Lindsay Gillette, Manager of Rate Setting, Department of Vermont Health Access. Welcome.
Thank you. Lindsay is not here yet. She has another meeting that starts at 10. She should be here at 10:30 if you guys don't mind waiting a few minutes.
And are you ready?
I'm ready, yes.
Well, the floor is yours.
Sure, I'll go ahead and get started. The good news is that this rule is pretty simple. Basically, Lindsay's here. Just one second. Okay, great. So basically, at a 50,000 foot level, and Lindsay is here if the committee has any questions about technical details of how this works, but we set rates for Medicaid rates for nursing homes prospectively based on historically allowable costs. Basically, looking at past costs to see what the model should say for the future, what we should pay. We use an inflation factor to adjust that to what the current year should be. This year, that inflation factor for the nursing care cost component was 9%. So we already inflated our rates by 9%. As you probably know, nursing costs have skyrocketed this year across all sectors of the healthcare sector. In the nursing home context, nursing home facilities have been hiring contract nursing, and they've also been increasing salaries and benefits to their staff nurses as well. This year, in the Budget Adjustment Act, Act 83 this year, at Section 46, the legislature directed the Agency of Human Services to come up with a plan to defray the costs of that increased staffing for nursing homes specifically. And to implement this provision of the Budget Adjustment Agreement, the Division of Rate Setting suggested and the agency agreed that we would increase the normal inflation factor that we already imposed to whatever the appropriate amount should be for this year. So the trade association for the nursing homes surveyed their members, and when we worked with the trade association to determine just how much nursing homes have been spending, and we determined that on average, facilities in the state have actually increased their nursing care costs by 18% or so, an additional 9% over the inflation adjustment that we'd already provided, which is crazy. I mean, that's huge. That's a huge spike, as you guys know. So we've drafted this emergency rule basically just to say that we were going to add that additional 9% in to the normal inflation factor. We've directed Lindsay, the director of rate setting, to issue new rate sheets that account for that 9% inflation. It's still subject to existing caps in the rule, so we're still not going to pay more than a private payer is going to pay, and other caps already there. That those are not have not been adjusted by this emergency rule. It's just that 9% inflation. The agency estimates that there's going to be about $6.1 million coming out of the Choices for Care budget going to facilities because of this rule. That could change depending on the acuity of residents and some other factors, but basically $6.1 million is the estimate of how much this emergency rule is going to push out to facilities. There have been a couple revisions since we submitted the rule. After we submitted the rule, the committee's counsel identified a couple concerns. Basically, the concern was whether the rule was clear that it was retroactive and clear in how it was going to operate. And of course, you know, when you're the agency, you think something is very clear, but then when someone else is looking at the rule, they might think differently. We work with it every day and not everyone does. So we've suggested some revisions. I believe you have the revised versions in front of you. Basically, the revisions just tweak the effective date section and then further tweak section 5.8, the inflation section, just to make clear the rule is intended to be retroactive for this fiscal year. And we're going to issue new rate sheets that reflect the inflation adjustment. And with that, I'd take any questions from the committee.
Senator Lyons.
Thank you. And thank you for your presentation. It was very clear. And obviously, the one concern that I think we might have about this is the transfer of money from Choices for Care to nursing homes, where our goal has consistently been to move people from nursing homes to allow for them to stay at home. My only question, I understand that this is unavoidable at this time, but my question is, what discussion, if any, did you have about that transfer of funds and the policy or the principle that we have in place?
That's a great question, Senator Lyons. You know, at our level, just within DEVA, just at the Division of Rate Setting, we don't steer that conversation that much, and so I will tell you that that conversation is ongoing within the agency. But for this rule, we're just trying to implement what the legislature has directed us to do to adjust for the impact.
And were there explorations of other, I won't say pots of money because there aren't pots of money, but other places to identify supplemental funds for this? And I know the difficulty, but just what thought was given to that?
And to that, I don't know the answer to that question, Sarah Lyons.
Okay. All right. But it is something for us that we, in our position, will be thinking about. But thank you again for your work. Appreciate it.
Questions for the witness? This is, you said that the rate change is retroactive for this current fiscal year for the last 11 months?
Yes.
And then would, in a month and a few days, would be in effect for the next fiscal year?
So the Budget Adjustment Act does direct the agency to come up with a plan for fiscal year 23 as well. As for that, we're surveying the facilities and just trying to get a sense of what even they believe would be an appropriate mechanism and the impacts they're currently feeling. I believe, although I might be getting out above my skis here, that the spikes might have started to level off, as opposed to what we were seeing this year, where just prices were continuing to increase quarter over quarter over quarter. So we're still trying to figure out what is an appropriate mechanism for fiscal year 23.
Thank you. Senator Bray.
So I have a question. It's not particular to the rule, but just looking ahead, when you're saying level off, but level off roughly 20% over higher than the prior year. Is that correct?
And that's where I am out of my depth. So I'm not gonna, and Lindsay might have more to say on that.
Sure. So just to clarify, this 9 and 18%, we're in that's talking, it's not a year-on-year inflation, it's inflation of the base year cost. So we're using, it's an inflation of the 2019 nursing costs. So it's 9 plus 9, so 18% from the 19 cost. And yes, we're really, there's a lot of factors at play, and so we yes, in terms of leveling off, where we'll need to collect more data in order to more completely and accurately assess that.
Thank you.
Questions for the witnesses. Mr. Lett, did you wish to add anything to the testimony by Mr. Lorak?
No, thank you. I think you covered it.
My apologies for not asking. Senator Bray.
Mr. Chair, I would move approval of Rule 22E10.
Can I add an amendment to that? Hopefully it's friendly. That we approve the rule with the proposed modification by the Agency of Human Services, Department of Vermont Health Access, and correspondence from James LaRock dated May 18th, 2022.
Okay. Thank you, Senator Benning.
Okay. So Senator Bray has moved that the rule be approved with changes, once again, technical in nature from the department that they have offered after the publishing of the substance of the rule. Any further discussion? Any comments? We often change budgetary things in the legislature with the Budget Adjustment Act. I'm trying to recall such a substantive monetary change being done retroactively through rules. And I may be wrong, but this is a bigger hurdle than we usually get through rules. I guess that's my comment. It's been moved that you have a comment, Senator Bray?
Well, I was just going to say, since you're bringing up something that you got me curious, what's the dollar impact of the 9% plus 9%? How many dollars are we talking about? Just like to better understand the impact.
So we estimate that it's going to be an increase of $6 million going out through the rates starting, I believe, over the next 2 months.
Thank you.
And it's characterized as consistent with rules, but this, I don't want to say that this committee is a backwater of legislation, but we don't usually get retroactive rate increases through this committee.
Isn't that something that would have gone through finance on our end?
I'm on finance, and so Senator Bray, I don't recall a discussion of this particular change. I'm sorry. Senator Lyons.
Yeah, so it was done through budget adjustment, and the previous rule that we looked at is also retroactive. It's a consistent retroactivity in the previous rule. This one is retroactive based on the work, I think, with appropriations, not finance.
Okay. So I think we'll take some comfort that we did, in fact, authorize in the Budget Adjustment Act back in late February or early March that we should be expecting this. If there are no further questions, the motion is to approve the rule with the amendments set forth in our, that were brought up by Senator Benning a few minutes ago. If there's no further discussion, all those in favor say aye.
Aye.
All opposed say nay, and the rule has been approved. That brings this short meeting of the business part of it, of LCAR to an end, and we want to thank the witnesses, and we will spend a couple minutes discussing our schedule for the next few months. Thank you. As chair, I take some responsibility for not having gotten the rules or the changes for our actions this summer. I believe that we were waiting for a joint rules committee meeting to authorize us to meet online and cut down on the long commute that some of LCAR members had to make for meetings that are sometimes short. And if Anthea Dexter Cooper, our counsel, has shared with us that the solution is not so simple, that we have been required to meet in person by resolution of both the House and the Senate, and only a counter resolution could permit us to go and online unless we found some method to do it without objection. And I don't think, I don't know of any such method. So are there any questions about why we're obliged to? Senator Bray.
So I guess this is for Ms. Dexter Cooper. Is this going to be, will this apply to every working committee or joint committee that's going to be meeting through the summer and fall until the next session is convened?
So you are still operating under Joint Temporary Rule 22A, and that says, joint committee shall return to in-person legislating except that a member of a joint committee may debate and vote remotely in that committee if the member notifies the committee's chair or a co-chair as applicable that the member, I'm reading through the strike through, that a member meets one of the following conditions. The member is tested positive for COVID-19 and is within a required period of isolation. The member has been exposed to COVID-19 as a close contact and is within a required term of quarantine. The member has COVID-19 symptoms and is awaiting the results of a PCR test. The member has a household member who relies on the member for caregiving, and the household member is required to be home due to one of the reasons set forth in subdivisions A to C of the subdivision 1, or because such household member's daycare or school program has a short-term closure due to COVID-19, or the member provides to the joint committee chair or a co-chair, as applicable, written documentation from a healthcare provider indicating that the ongoing COVID-19 pandemic requires the member to participate remotely due to the member's health condition. And then the definitions track the ones from the Vermont Department of Health guidelines. Joint rules is authorized to meet remotely as necessary to address COVID-19 related matters. The remote authority set forth in this rule remains in effect through December 31st of 2022. And then there is a sort of, if the governor does, then joint rules can provision that says that if the governor reissues capacity restrictions at gatherings and events or requires masks and physical distancing in response to COVID-19, then the Joint Rules Committee is authorized to meet remotely and permit joint committees of the legislature to meet and vote electronically as the Joint Rules Committee determines appropriate. So that is when joint rules would be able to make a change. So this is applicable to joint committees. I do not know, because I don't staff any sort of combination entities, whether it would apply to like the pension task force working group or anything that existed in prior years. I see that Mike is here. I don't know if he's gotten guidance from like an operations perspective about what other committee types are going to be doing over the summer. But I corresponded with Clerk Rask about this because I figured it was going to come up. She, agreed with my reading on 22A. Secretary Bloomer was CC'd on all of the correspondence. So my understanding, based on the conversations I've had with Clerk Rask, and my reading of this is, unless something happens that changes the authority that joint rules has to permit you to meet remotely. You need to meet in person unless a member meets one of those 5 sort of alternative circumstances, in which case they would be able to participate remotely, and then they would count towards quorum. So if someone was participating on Zoom and they had notified the chair that, for example, their daycare was closed, then that person would count a quorum. Otherwise, not going to count towards quorum.
Which puts those who travel a great distance at a disadvantage, or makes their sacrifice greater. This committee has always met in person before COVID, so this is we're
The way it is.
we are where we are, and I've spoken with Charlene and Anthea, that perhaps it would, to the extent that we can schedule rules and ask the administration on occasion to voluntarily wait a week or 2 longer, we could perhaps meet less frequently. That would be travel fewer times and save the state a couple bucks in our per diems. But that seems like those are the best we can do, barring a reconvening of the legislature and for some reason to change the authority for our meetings. Would anybody, I think that's the complete update. And, if anybody has any questions, we've got council and legislative office people here. Senator Bray.
So does that mean we are aiming for a next meeting of June 16th? Is that, I heard that date before, but
June 15th?
16?
16.
All right.
Charlene?
Yes, the next meeting will be June 16th.
And the only rule and the deadline for that meeting, Charlene, when is the deadline for that meeting? I can look it up.
May, the end of May.
Yeah, it is the end of May.
30th or 31st.
Yeah, so you have, another week and a half. If there are no more rules that are filed in that week and a half, you only have 1 rule scheduled for June 16th, and it's an emergency rule. So LCAR doesn't have that 45 days to act same window, because the rule becomes effective as soon as it's adopted, since it's an emergency rule. So there's no harm in postponing that meeting a week or 2 if you wanted to, which means you could meet towards the end of June.
So should that be the only rule on June 16th, it will be adopted regardless of what if we were to say vote that it shouldn't take place, it's going to take place anyway. And the only avenue to deal with it would be someone going to court.
Well, no, you could still object, but
We could
it's
object.
an objection after it's become effective, not like with the permanent rules where you get to object before it becomes effective. Charlene was trying to say
So
something.
I just got an email like 10 minutes ago, somebody's filing a
Oh, okay.
proposed rule with me, so there will be 2.
There will be 2 on the 16th.
For right now, there was 2 rules.
Okay.
But the 45-day review period would allow them to go out 2 weeks. So you still could potentially skip June 16th if you so desired, I think.
So I think we would desire to skip it if it were possible, but the decision to do that might not, if we got a couple more rules in the next 2 weeks, the situation would be different. And we might choose a different recommendation. And this is new territory for us. So trying to see what the possibilities are as we endeavor to drive fewer long distance trips and invest more days for short meetings.
Can I inquire of Michael? I filed expenses this morning, but it still says legislation in session.
Right, so,
In session.
yep, we keep the expense templates open until June. for members that submit after the session ended. All you have to do is just, I can show you, I'll send the committee an email about how to do them for this meeting. It's different coding.
Okay, so you're gonna reject the one I filed already?
No, what you did was fine.
Okay.
Any further discussion on the topic of our duties for the months to come? Is there any other business that committee members would bring up? Which means
I move to adjourn.
Sarah Benning moves that LCAR adjourn the meeting for the day. No further discussion. All in favor, say aye.
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 Opposed, say nay, and we are adjourned. Thank you, Southern Alliance, for